So very good afternoon all. Bayer Animal Health welcomes you all for this live webinar. Bayer really appreciate all the attendees' valuable time for this webinar. And we are happy to share this information that for today's seminar, we have participants not only from India, but also from the other Asian countries as well. So Bayer Animal Health welcomes all the other participants from other countries. So myself, Dr. Bhushan, and Group Product Manager for Poultry Division. Today, I am the host for this today's webinar. Today, we have Dr. Jayaraman as a guest speaker, who is a well-known poultry consultant in India. Dr. Jayaraman was graduated from Madras Veterinary College. He has now more than 25 years of experience in poultry field. He has expertise in breeder operation as well as in hatchery management. He is a well-known person in poultry field for his troubleshooting capabilities and differential disease diagnosis. He not only provide consultancy to India but also to the other regional countries as well. He also has a very good acumen in the field of vaccine and interpretation of the titers. So this is about our guest speaker, and so today's topic. Today's topic is very interesting one and which is directly related to the poultry health. As we all know, poultry is very well accepted as a good source of protein. And looking at the per capita consumption requirement, the poultry will be forced to intensify towards higher production and increase in the number of placement, which facilitate the transmission of infection pathogen. So the country like India, where poultry challenges are different and which are actually vary from region to regions. So there are some unknown emerging challenges and which is currently troubling our industry, our poultry industry. And Dr. Jayaraman is here and he will be definitely going to highlight on these emergency challenges. Okay, so let's see if we are ready for these emerging challenges. So I welcome Dr. Jayaraman for the live webinar on Are we ready for emerging bacterial disease in poultry? So before start, I'll just make one request to all that please type your question to our question chat box. Okay, so now I'll hand over to the Dr. Jayaraman. So over to you, sir.
Thank you, Dr. Bhushan. Am I audible? And my screen is on. You are able to see?
Yes, sir. Yes, sir. You are absolutely audible, and I can see your screen as well.
Okay. If there is any these things, you kindly let me know in the chat box. Or something like
yes, sir.
Yeah.
Yes, sure, sure.
Thank you. Thanks for that introduction, Dr. Bhushan, and thanks for the Bayer for giving me an opportunity to speak to you on this afternoon on emerging bacterial diseases of poultry. The emerging bacterial diseases, if you ask, it varies from countries to country and locations to location. But these presentations I would kept in mind of these SAARC countries and predominantly India, and taken note of it and made this presentation. I'm sure some of the messages, some of the subjects which I'm going to discuss is also would be relevant to your countries as well and to the regions as well. If you look at the definition of emerging diseases, it could be termed in, you can classify the disease emerging if it falls in within any one of these categories. It has to be previously undetected one, and right now we have understood better. So we can say it's an emerging disease. If the pathogen is spread from one location to new locations or new populations. For example, if you are having problems in India and you are getting issues in Bangladesh or Sri Lanka recently, you might still term that as an emerging disease. Or the third category would be like earlier we know the agent, we know the pathogen, but probably we have not recognized it as it should have been. That's the one. It's very much I'm going to take up on the case studies of today's emerging diseases. So if any of the pathogen or bacterial diseases are falling into these categories, we can say this it is an emerging diseases. Sometimes we will also consider when we talk of emerging diseases, we will also a terminology will come as an re-emerging diseases. Means it was earlier an emerging diseases, sometimes it fade off, and after that again it is coming back. For example, if you talk of the avian nephritis virus in worldwide, sometimes you would find mentioning as an emerging pathogen, but it would be fade off. It used to come like a waves and it would fade off, and again after some years you might find that particular disease coming again. So that is the definition of the re-emergence of the diseases. Today we are going to talk on the emerging diseases of the bed. Today the topic could be I am going to restrict on only the bacterial diseases. So there are viral diseases as well, but for today's presentations I am restricting to the bacterial diseases. These are all the bacterial diseases. If you like to know, everyone knows this: Salmonella, Pseudomonas, Cholera, coli, coryza, and so on. So it's quite a big list, but I have taken the major issues just for the sake of today's classifications. If it comes to the bacterial diseases, the normal mindset of, would be, sir, it's not that big deal. If I get a problem, I would hand out with help of antibiotics. Anyhow, if it's a viral problem only, it's a really catastrophic and it's a really difficult to handle. Bacterial diseases, I think we can handle. To some extent, it is right, correct, but not entirely. We would see that in the coming presentations why it's so. So bacterial diseases as well has to be given the equal importance. The coming days are going to be the coming times. First, let me talk of Pseudomonas. You would wonder, Doctor, this Pseudomonas is not a new one. It was there from the time memorial. Why you are calling this as a Pseudomonas as an emerging diseases? I have a reason to believe, and this is an emerging one. Reason, if I look at the third classifications of earlier, we know Pseudomonas, but we have not known the level or the extent of the infections the Pseudomonas is causing. Sometimes we tend to generally think only if it's in very severe form and we identify, we tend to say it's a problem, but it is much more than that. If you look at the incidences, the occurrences are there in the broilers, layers, even in the breeders. It's not that only broilers or layers are getting affected. Equally, the breeders also affected. Normally, we tend to say it's an hatchery-borne infection. Let us see more about it. In general, it is, everyone knows, it is associated with the first week mortality. Probably people who are there in also having hatchery, they will understand very well. So sometimes you would find high amount of dead in shell percentage, and the integrated farms will understand, okay, this is a problem associated, started from hatchery, something like that. But probably that's an underestimated statement. We would see how and all it's going to be happen apart from the hatchery. The Pseudomonas, it's believed that at the process of hatching, infects the chick, it infects the embryo. Through the unhealed navels, it gains entry into that and causes the problem. You would understand in the hatchery, you would have a high moist content, wherein it's quite easier for these organisms to digest the cuticles and just get into that. Okay, if you see these kind of chicks, what would come to your mind? Oh, paste event. We'll tell, sir, it's the people from hatchery, they have not cleaned it properly. The people from hatchery have not segregated the weak chicks. People from the hatchery are all sending second grade chicks and everything just to send it to us to show that their hatchability is better. We are getting these kind of chicks. But to some extent, that's also possible, I would say. But we have to look at slightly more than that. Is it only that? Is it sometimes, if you look at that, I listed a couple of more organisms. It could be Salmonella, it could be E. coli, it could be Pseudomonas, sometimes Staphylococcal, sometimes combination of Pseudomonas and Staphylococcus as well. So you cannot just simply say only one particular reason for your commercial chicks to say, okay, I'm having this kind of a problem, and let us see what's that. As I mentioned earlier, whenever it comes to Pseudomonas, hatchery hygiene will come to the mind first. Again, is it only the hatchery hygiene? Yes, partially the answer is yes, but it's much more than that. This kind of appearances you might have seen in the field. When you have a high amount of mortality, when you see a kind of an unobserved yolk, sometimes green tinged unobserved yolk, you could tend to say, sir, it's a Pseudomonas infection. Sometimes we do get staphylococcal as well, but for the sake of these presentations, we will take it. Okay, possibility for Pseudomonas as well is there. And how much is this greenish yolk is associated with Pseudomonas? If you look at the hatchery manual or the breeder, these things, you would have observed there are some mentioning about green or greenish tinged yolks are sometimes normal only. Is it how to differentiate this particular thing? You are saying that possibilities is there for Pseudomonas, but the book are describing sometimes it's uncommon. I will explain it a little bit more on this particular subject. If you look at these particular chicks, you would find the fluorescent green. It's unmistakably, you could say, it's a case of Pseudomonas. Sometimes you might find other pathogens as well, but mostly, for example, staph, but mostly the predominant one in this case is Pseudomonas. So whenever you can see this one, you would have a alarm bell ringing and saying that, sir, I have a problem and you have to take care of this one. Let us see the normal one. Please look at the one which is on the left side, which is quite a normal one, and please observe this, the one which is on the right side is on the green. So now you can understand which one is the normal and which one is the abnormal. This would be probably a Pseudomonas positive. When I come to these questions of trying to differentiate, look at this picture. This is quite a nice yellow color yolk. No way it's a kind of an infections, and you can say, okay, right, this is probably the nice one. When come to this one, you would find a mild tinge of greenish in this particular these things. You can see here mild the greenish one, and this still the yellow is there. You cannot say this is normal. This is where the trouble comes, trying to understand, sir, is it a normal or this one? Diagnostics will help you in this particular regard. Please see the next one. The same flock, the same the parents are these things, and then over a period of time, we found these numbers as well. So this, by looking at it, what you could say, sir, this is clearly a kind of a Pseudomonas infection. So to come to that, the one which is on the left side would say the normal. You can say if it's very clear, and this one you can say normal. But if you look at the right on top of it, the one which is having a kind of a greenish tinge, you cannot declare it is negative. In cultures, we have found quite substantial time it was in positive for Pseudomonas as well. Of course, the one which is the bottom, you could very easily spot it out, but this is the one you have to be aware. Many times you don't get this particular classical case of infections, but you get this particular one, which is in suspect range oftentimes. So you have to look for that. When we are trying to look at some more these things, I often found these kind of a greasy gelatinous breast muscle at the day one. I tried to go through some literatures and the publications. I never found any mentioning of that. But in the practical field conditions, when we do the break open analysis, and I found a quite substantial amount of times, I found this kind of picture. So this just for an information, you can take it with a pinch of salt. You could still look for it. This is a conspicuous lesion, edematous lesion over the cranium. I found this particular one in infections. Sometimes you might find even the contaminated vaccines. Even it has happened through the Marex vaccinations as well in the breeders. It has happened in commercials when you are trying to inject even the gentamicin injections. We found when it is mixed with these things, when I inject contaminated waters, has given this kind of lesions. So one has to be careful. But this particular lesion is one of the pathognomonic lesions of Pseudomonas. If you look at the hatchery, you would find not only high amount of dead shells, you would find unhealed navels as well. You find the live pip embryos quite substantial times. You find these kind of greenish tinged chalky white materials as well as a kind of a deposits over the embryo. When you're going to talk of the hatchery, when you are going to do the what you call break open and analysis at the time the hatcheries, you would often find at the heights of the infections, you would find it's not only the embryos death, live embryos higher a percentage, but as well as these kind of a chalky greenish materials also used to present in the embryos. This is a live embryo just taken out of the hatchery, pipped but not able to come out. In these particular conditions, you could find this kind of an unabsorbed yolks as well as the greenish tinged yolk material. So this is another clear indications of what is for the Pseudomonas. Okay, coming to the causes, where from it is coming. See, normally we will look at this particular part, hatcher and hatcher hygiene. Yes, hatcher and hatcher hygiene, I would say the predominant, because the Pseudomonas grows very well and causes the maximum damage because the growth conditions are very favorable, especially in the humid conditions. Where is humid conditions? It's in the hatchery is the highly humid because chicks starts peeping out. During peeping out, you find lot of water. Even you find that you are always the humidity used to be on higher side. The Pseudomonas organisms are quite good at that, so it's able to digest the cuticle and just get into these ones. So that's the one particular thing. Of course, the cleaning, but sometimes you might find these particular conditions very clearly. There is a hatchery. You would say, for example, you take the conditions of an Indian, these things. It's a mixed with a multi-age group setting. The hatcher manager would come and tell you, sir, you are trying to fix me on saying, sir, hatchery hygiene is not good and try to improve, try to clean more and everything. But I'm setting the same machines, some other these things. I'm not getting it. If it's not cleaning good, why it should happen so? Yes, that means hatchery alone is hygiene is not alone there. When we found sometimes I had a chance to, being a consultant, had a chance to see these kind of situations. Then I thought whether any possibilities of breeder health would be there, but in assumption there could be some possibilities. When we started treating the parents, we found very significantly improvement in the hatchery. Later on, when I did some search and on the literatures, I found enough indications that breeder is also implicated. Sometimes we found, especially during the peak period, the peak cutoff was stagnated. There was no mortality. Absolutely, chicks, birds looks okay in the parents. It doesn't found good amount of these things. We found positive. Egg surface, we found positive. So all these indicates what? Sometimes, most of the times, it is hatchery hygiene. I agree, but sometimes parents' health is also indicated. Third one is quite interesting one during the transfer. We never consider the rooms or the halls as a major sources of contamination. We always say if it is a problem is there in the and these things we tend to say look at inside the machines, setters and hatches, but there is another part, another area is the transfer room. If your transfer room or the transfer process is held in unhygienic conditions, you will get this problem. I was mentioning about the breeder implications. Please look here. There is a report from Cairo. Amir et al. Has reported that when they isolated the Pseudomonas from the ovaries. So that it means what? It is, there are good reports are found even in Indian reports. Shamir et al. Also reported the similar fashion that in salpingitis cases they found Pseudomonas got isolated. So that means in Turkey there are quite good amount of publications and reports are there, but in the broiler breeders or in the layer breeders, it's not. I have seen the similar conditions of the layer breeders having trouble and passing on the trouble to the commercial layer chicks in other the nearby country. I have found this particular problem I have handled these issues once in Bangladesh. Look at the hatchery hygiene audit. Yes, we would happily always try to tick this one, and this Pseudomonas is there, and so hatchery is problematic. Yes, you have to take care Pseudomonas, but more than that, equally you should look at all other places as well. If you, I was mentioning about transfer room hygiene. There is yet another element in this one. It's not just transfer room as well. Sometimes even transfer process. If your transfer room is not clean, when you are going to do these kind of in vivo vaccinations and all, if the hygiene is not at your best, you will not get the best performances. There is a quite good amount of chances you would get this, because egg cuticle is eggshell is broken, so quite nicely the organisms will invade. It doesn't require very much trouble to get into that. It nicely invades. So the process is, I will not say any trouble, but the hygiene, you have to be more careful. So coming to the suggestions, hatchery machine hygiene is certainly quite critical. You have to, when you are trying to clean the disinfectants, please be aware. It's not only the how much you are doing. You have to be very careful in trying to look at it. What is the type of disinfectants you are using? Because Pseudomonas is highly resistant one. For example, even at the hospitals and all, you might find they are using sometimes for the floor and all is sodium hypochlorite only, because it's quite tough. In some places it's a corrosive, you cannot use it. But for the ordinary these things, because it has a kill percentage of 99% in the book. So you have to be very careful. Third one is that the contact time of the disinfectant. That's quite crucial. If you're trying to just spray it something and trying to mop it and leave it, it doesn't work. So 5 minutes, 8 minutes and above only, you find sometimes a disinfectant start working on that one. So you have to be careful on that one. Hatchery room hygiene, I have mentioned earlier. Breeder health. When you're trying to look at the breeder health, when you have a problem in the hatchery, don't try to always look only hatchery. Sometimes you might look at the breeder health as well. In these particular situations, isolations gives you very nice indications and the idea whether you have a trouble or this. Hatching egg fumigations. Sometimes, if it's tough, you may have to go for 2x to even 3x as well. So that's very, very important. Last one, this is quite resistant, as I mentioned earlier. You have to choose the right antibiotic, look at the sensitivity, then please go for these injections. So this is the suggestions for overcoming Pseudomonas. When I look at this particular Pseudomonas subject, when to talk on this webinar, I didn't find much presentations in most of the textbooks. One gentleman from Ethiopia has exactly captured the same feeling what I had. Pseudomonas infection is not included in many textbooks, poultry textbooks, but as per our study, this can cause serious economic problems in the poultry farms. I do endorse his opinion. With that opinion, I just move into the next subject. Second one, Warty is the next emerging pathogen. Warty is short form, we call that it's a Ornithobacterium rhinotracheae. This is basically a respiratory pathogens. You have in recent times gaining big momentum. It is it's a recent pathogen. It's not quite early like even Pseudomonas. It's a recent pathogen. It is 1993 was identified, but it was renamed in 1994 by Vvnd. In 2008, Dr. Gopal Krishna Murthy and team has reported in Namakkal. If you look at the respiratory pathogens of what it has, this particular data has been from Dr. Gopal Krishna Murthy's presentations of the report. You find Warty is around 15%, yes, isolated, but please look at the combinations. Warty and E. coli is 34%. So this report is in commercial layers. When he tried to understand what is that, so it's now 2020. So in 2008 itself, this happens to be highest amount of the incidences. This is a publication from by the article as Avian Health by Dr. Trevor J. Bagust, University of Melbourne Pathobiology. He has reported this one. Please observe this ORT. He found in Asia, Southeast Asia, everywhere it's present. So the similar time when we found in India, he has also reported he is particular these things. That means it is there all over the world. When you come to the poultry, as I mentioned earlier, it's broilers, breeders, and layers. It's affected. You might wonder, sir, we didn't hear much of this one. We didn't. We know something in commercial layers. So there were some reports. I agree. You are mentioning about in the breeders, and the thing is, it is also getting reported very widely worldwide in broilers as well. If you look at these things, as I mentioned, broilers, leaders, and the breeder chickens, it's affected. When we had a problem some time back, it was quite confusing. Initially, any emerging pathogens, first time when you are going to see, you will not be able to identify. You will not be able to look at it and say, this is the problem. So initially, I thought it was a case of an fowl cholera, but predominantly it was affecting only during the peak period. So when I was doing some search and everything, later on I found some literature saying that this particular what I have marked down here, common in broiler breeders in 24-25 weeks of age. So then I started looking, and given the samples for isolations, surprisingly I found in broiler breeders the ORT. So it was called that time. Then when I saw the literature and everything, it was described as a fowl cholera-like disease. Means what? It's so closer to the fowl cholera. Let us see a bit more detail. When I come, this is in broiler breeders. In the during the infection, the initial stages, I found you will find drooling of saliva is quite conspicuous. You will find not all the birds, but some birds will exhibit this particular the drooling of the saliva. Then mild infraorbital sinus swelling. At this particular time, you will get some confused. Sir, this otitis is you will get in fowl cholera as well, sir. This is maybe FC only. But later on, I found this quite eyes and all is swollen, infraorbital sinus is swollen. So you would find good amount of these kind of birds you will find. this is in a just video. You could see it's in a broiler breeder in cages. You will find how it's behaving. So this kind of a meningitis you would find. So you will get confused. What's this particular kind of a behavior? And later on, you will find this kind of I just put it as a torticollis rather than that. Okay, it's kind of an opisthotonous position, just to show you the kind of typical postures here. It behaves like this. And finally, this is a bird which is in deep litter, and you find see this video how this behaves in the later stages. So you would find this kind of a very typical head shaking positions will be there. So these are all the symptoms in the broiler breeder. If you come to that one, this is in the commercial layers. It's an unilateral congestion of the lungs and tracheitis. If you look at the tracheitis, people will often get confused with sometimes with the kind of an ILT or influenza or something like that. These most trachea used to be very confusing one. So only the diagnostics will give better picture. This is in the lesions. If you look at this, you would find petechiae in the thigh muscles. So you will find these kind of lesions. Abdominal fat as well will exhibit petechiae. This is a common kind of thing in a septicemia, but in Warty, very pathognomically used to find this one. Subepicardial fat hemorrhages. Often you would find in fowl cholera as well. That is why I said when we see the cases in the first time, we got confused. We were thinking this is a case of fowl cholera. You might see the petechiae in the rib cages. You can see very, you would find bronchopulmonary pneumonia, congestions, and frothy, and very clearly lungs would be affected. Later stages, you would find congested ovaries. This is a common symptom sometimes in the heat stress as well, but during stress also it happens. So that's because of the stress even then, but this is quite one of the lesions in these particular things. Right. I was mentioning about the reporting. Dr. Gopal Krishnamurthy and team, you might find in 2008, they have identified and reported this one. And just look at the nearby countries, even in the Pakistan, it's quite reported. It's not that you might find this year of publications, it is very similar, almost same 2008 they found. They have reported in broilers, layers. In both cases, they have initially started recording in broilers and layers. In what's the status in nearby country? Very nice presentation article published by Dr. Zafar. You might find he has done these presentations in broilers and the team, and broilers in Sonali. Sonali is a kind of bird where it is a kind of, desi bird. I'm sorry, it's a jewel bird, which is used in a kind of a village rearing. So they use it for the meat as well as the egg. It's a brown color bird. It's cross between rock and Fiume kind of breed. So it's very much found in the Bengal regions. You will find in the broilers, yes, observed this one of a 43%. In Sonali, it is a 55% seropositives. So that means hello, hello,
Hello.
hello, 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 hello.
Yes, Dr.
Yeah, I'm
Jayaraman.
trying, something
Hello.
went wrong.
Yeah,
I'm just
yeah.
adding once
Now
again.
you are live, sir. Yeah. You are live now, sir.
Yeah, you're able to see that now?
Yes, sir. Yes.
Okay, I'm sorry. Sorry for that. Somehow I lost the connection. Uh, uh, Dr. Bhushan, am I audible and clear now?
Yes, sir. You are audible, sir. Yeah.
Yes. Okay. So to continue that, we find the Warty is quite prevalent in the neighboring countries as well. So you have to look at this one. So if you are looking at these ones, probably you might look at other reasons as well. That means your severity of the Warty depends upon the synergism. The synergism mostly it doesn't strike you in the preliminary as a direct one. It strikes you in cases of uh, conjunctions with other pathogens. For example, if you want to induce Warty in as in to see how it is affecting in challenge studies and all, normally for the broilers or the breeders, they will induce with the what you call the Newcastle disease and try to and just let me minimize this one. Hold on. Okay, I'm sorry. Yeah. So when you try to do it with probably you will have to do that. So when you if it's any stress, if there is any Newcastle disease, you get infection disease. Production is also a stress. Diagnosis, when you can define the conventional, this one it's quite tough. The reason being, it's not tough in the sense sometimes if you are not quite sure what you are looking for it, you will not be able to get it properly. For example, if you are trying to look at the nutrient or McConkey, this growth doesn't come that much. That you have to go for a blood agar to get this one, and then only you will get it with this one. One important thing is when you are trying to not sure you are getting it, sometimes PCR gives you a better solutions. Assuming in the earlier days you are not getting something um, uh, this one means you are not able to get it the organisms because after some period of time you will lose it. But what happens is when it is happening in later stages of life, you will find titus. You have got a Warty titus, so quite nicely, you can check up with help of the titers. So IDEX kit is there, biocheck kit is there. You can do that. So currently we are employing
Sir,
those diagnostic.
Dr. Jayaraman, Dr.
Yeah,
Jayaraman, you
yeah.
need to go for full view
Full view.
of the PPT presentation.
Now, is it okay?
Full view, sir, full view.
1 second, doctor. Let me see that one. Okay. Live. Stop sharing. I should go to that one. There are two windows are there.
No, F5. When we do F5, na same. The full view.
Yes.
For presentation. Niche,
Is it now, doctor?
No,
1
sir,
second. I will.
On the
Yeah.
on the bottom itself. On the bottom, sir. When you enlarge that PowerPoint presentation, na, that will come in the slide format, but you need to hide that.
Hold on, doctor. Kindly hold on.
Yeah.
I will stop sharing and do that again.
Yes.
Because there are two windows are there. I'm not sure which window I am there right now. Okay. Is it disconnected now?
Yes,
okay,
doctor.
Screen.
Just
yes. Now you are able to see?
Yes.
You are able to see the full view?
Yes, now you can see in full view.
Yes.
Okay.
Yes.
Okay. Right. So,
just minimize
sorry,
the Teams view,
yeah.
Teams window.
Yeah. Please. Thank you. Sorry. Sorry for that. I don't know. I just went to the next screen while opening up. So when I look at this pathogenicity, as I mentioned earlier, synergism is the one which is creating trouble. When you come to the diagnosis part of it, during the diagnosis, you have to be very careful in trying to look at all the possible things. One is the serology, microbiology, and sometimes the PCR as well. You might miss it if you are not going to take the samples right on time. If you are going to take it in the later stages, you will not find the organisms, but you might find the titers. Suppose in the active phase of the disease, if you are finding overgrowth of the organisms, you might, because when you are supplementing the colonies of Staphylococcus and everything to supplement NAD, you will not get the overgrowth of other things. It will suppress this ORT. So you have to be very careful in that one. Okay, coming to the differential diagnosis. Differential diagnosis, you find often, as I mentioned, just like that fowl cholera, you will get this one. So you have to be differentiated. One important thing is that in fowl cholera, when you are trying to look at that, you will not get colonies isolation in the livers. But in especially in fowl cholera, you will get lot of colonies, but Warty you will not get isolated. But if you look at by and large the lesions, it will look like same thing with the calcium tetany. Calcium tetany, why you want to differentiate? Many times when it is getting hit during the peak period, you tend to think this is a calcium tetany. So if it happens with the calcium tetany, so you will try to say, okay, I have a problem, and that's the reason I am getting it. So you have to be careful with calcium tetany. I will explain. Sometimes by looking at the nervous symptoms, by looking at the Newcastle disease, you will find looks like it's a case of Newcastle, but it's not actually Newcastle. As I mentioned earlier, Warty and fowl cholera, from the organs we isolate, we can to some extent detect, and through the PCR, and also through the IMBIC test. IMBIC test is another very, very clear differentiator. You can understand it. Calcium tetany, why you tend to say it's an calcium tetany? Sometimes when the birds come to a peak before right before time, and when the calcium is not sufficient enough in that particular cases, you find it. So because this particular bird is getting affected during the peak period, also it is happening during the period of just come to the point of lay. So you will sometimes get confused with that. You might analyze with a blood calcium to serum calcium, but of course that's a kind of academic this one. But by looking at, but in calcium tetany, you will not find these kind of lesions, these petechial hemorrhages, congested ovary will be there, and abdominal muscles hemorrhages and all will not be there. Sometimes the differentiations between Newcastle and Warty. Newcastle, you will find these kind of neck twisting will be there, but in case of Warty, it is a slightly different one. So when you are looking at the different the pattern, and the Newcastle, as I mentioned earlier, it will bend its neck completely, and it will try to show that one. So you will have these issues, but by looking at these two, you can differentiate. And next one is that what you call vaccines prevention. You have got 2-3 vaccines. One is the live attenuated, which is of course not available in this region, and inactivated and recombinant vaccines. The idea is that when you are going to the inactivated vaccines are primarily, and recombinant vaccines primarily, they are using it in the breeders. The idea is that when you are going to give that vaccine, you are trying to get some kind of protections to the commercials as well as to the breeders. But in live and attenuated ones for the broilers, but it's not a very widely practiced these things worldwide. So there are some reports as well in the layers as well. They found experimentally when they found it was working well, but when it comes to what you call the practical applications of the vaccination, still we are in a long way to go. Treatment. Yes, any bacterial diseases works well. So antibiotics is definitely helpful, but it's quite critical to see the sensitivity. You might think, sir, I'm just giving some antibiotic. I think it should work well. Is it really in this case? Let us see. There's a paper on antibiotic resistance. What's happened to the Ornithobacterium rhinotrachea? It's also quite early paper, not a new one. It was but if you look at the particular resistance patterns, it would be very tough to read all these ones. You can see from here, starting from gentamicin, neomycin, danafloxacin, trimethoprim, sulfacolistine, the line goes on and on and on for 4 lines, ending with the norfloxacin. So many drugs are resistant. Means what? You have to be very careful in trying to choose the medicines. Sometimes your intention might be good, your thought process might be good in trying to add up, but you will not end up in treating the right. Coming to the suggestions, co-infections are quite important. Stress is quite important. So sometimes, especially in the broilers and these ones, if the respiratory pathogens, other pathogens are present, you find it. In the broiler breeders, we found even the peak itself is a stress. That's the reason we are finding it this one. Vaccinations is not a big choice right now we rely on antibiotics, but even then we have issues with that one. As I mentioned, take help of ABST. ABSTs, you will get some ideas, but in my practical observations, penicillins and amoxicillin, derivative of penicillin, found comparatively working well. You have to follow the proper dosage regimen. This is quite sensitive. You might think, sir, I'm having a problem. I will sometimes inject even gentamicin, something like that. I'm finding neck swelling. It will not work. Reason is that even for isolating these organisms, we are using only gentamicin to prevent other bacterial these things from these ones. So when coming to that these presentations, so dosage is quite critical. If it is underdosed, we have seen that it doesn't work well. This applies to everything. Okay. Coming to the conclusion, emerging disease is difficult to understand initially. You know quite well. The reason is that not much literature should be available. Not much information should be available. Perform ABST before taking these things. If not possible, just give the medications earlier and try to do in the later stages. You would understand what is the one drug which is working well. So it will give you cost in the saving and also the right choice of what you are to do. Third one is that take advantage of molecular diagnostics. They are quite sensitive. You will get the better performances. Last one, never expect too much on textbook descriptions. They could give a hint, but they don't give you complete picture. When we start working on these particular diseases, very few descriptions I used to find it out. Now, when we look at the broilers, when you have a problem, if you're having any respiratory problems, immediately the mind will come to saying that it's a case of CRD. So I have given medicines, I have given injections, it's not working. Sometimes it will not work. Why? The problem is not that one. If you give injections of gentamicin as well, if you give that other things also, it will not work. So unless we know what is in there, we will not be able to treat it properly. Layers, co-infections is quite common. Of course, it works well, but it is difficult to differentiate. So better perform ABST and go there. The message on this one is that because of lack of diagnostics, we find not a good amount of knowledge on these things. But with the available knowledge and these things, I have tried to make this presentation. I have presented some photographs of some products of some companies, etc. That is, we do not endorse any company products or these things. Those photographs and these things only for the graphical representations only. And with this, I end my presentation. Thanks for your attention. I will wait for the Q&A sessions.
Yes. Thanks a lot, Dr. Jayaraman, for this beautiful session on this, emerging challenges. And definitely today we have learned a lot from this session that there are some challenges which might be not seen in the poultry industry right now, but since you have mentioned the Pseudomonas and Warty, these are now the emerging challenges, and now we should be ready, for this type of infection. And yeah, sir, thank you for your this enlightening, the topic, and hope there is lot to take away message for our participants. So I'll move to the next session, that is question and answer session, sir. So, so I have received a good amount of question here. So I'll just read it out for you, sir. So generally
Yeah.
there are like similar questions also. Some similar questions are also there. So I will join them in a single question. So there are
Yeah.
like multiple question on this subcutaneous edema. So you have shown this picture of subcutaneous edema in chick.
Yeah.
So most of the actually asking the whether it is because of this a high temperature in incubator, or maybe some lack of selenium in parents, or maybe something different infection. So how we can differentiate with the pseudomonas thing, sir?
Okay. But this subcutaneous edema is not a very specific for what you call only Pseudomonas. One of the lesions of Pseudomonas is subcutaneous edema. Okay. Sometimes you would find some mentioning of for example, in avian encephalomyelitis as well, you would find a moderate amount of swelling and also to some amount of hemorrhages in the cranium as well. So you would find it in some in the selenium. I am not quite sure, but I found even sometimes in Warty also we are finding these ones. You cannot try to look at only the one particular lesion of subcutaneous edema and try to come to a conclusion. You have to correlate. For example, if it is an encephalomyelitis, you would find that same kind of an edema as well as the lameness pattern will be there. If it is, for example, the Pseudomonas, you will find what you call the green coloration of the yolk and the greasy muscle, and you will find the head subcutaneous edema over the cranium. So you have to correlate with other couple of lesions as well to take a call.
Yes, sir. Yes, sir. Okay, sir. So the next question about is that you also shown the pictures of vent pesting, sir. And this is a typical characteristic in some of the bacterial diseases. So, so dehydration is also one of the factor in that. So how we can for disease diagnosis specifically with the Pseudomonas, is there any specific test, or with the naked eye we can see, or maybe after postmortem? Is there any specific method is there for that on the basis of vent pesting?
Okay, the questionnaire is trying to understand the difference between Pseudomonas infection and dehydration.
Yes.
If I understood, okay. In dehydrations, you would find normally happens if it is in hatcher. If the temperature is high, you would find dehydration will happen. Normally, egg to chick weight ratios, if it is lower than 65%, you would end up in dehydration. So that particular kind of a chicks will have what you call, when it comes out of it, you will find lethargy and not able to move around, and you will find shrunken skin. And when you cut open, when the birds died, you will find off feed and kidneys and all is sometimes you will find urolithiasis as well. But in case of Pseudomonas infections, the chicks would be nice, plumpy, they will be running around, they will go and take feed and everything, but you will find air sacculitis, unabsorbed yolk, and then pericarditis, and death will be there. This is the 2 points you can differentiate between dehydration and the Pseudomonas infection.
Okay, so there is one question, but I don't know. What do you think if we found gizzard erosion in pipped embryo analysis?
This tipped embryo analysis, we do are getting gizzard erosions. Sometimes certain type of mycotoxins do get transferred. We do get in that chicks, but very often another reason is also recent times you are getting. It's inclusion body hepatitis. We find this particular type of certain strains of serotypes of IBH also exhibit gizzard erosions in the chicks itself. So it's imperative. It's by naked eye, it will be difficult to differentiate which one is causing the problem. Probably molecular diagnostics will give you a precise answer. Because of what? These are all the major two reasons, but because of what you have to do through this one. Diagnostics.
Okay, sir. Okay. So there is another question on this Pseudomonas itself. So we want to ask that though the Pseudomonas is the hatchery born infection, so whether it is affect to the older bird as well, like, and specifically which species or breed is it related to any specific species or breed?
Pseudomonas affects mostly the up to first 10 days of age. Later on, during so any other oral route, or even if you challenge it, you don't find a significant amount of mortality. But if you look at the parents don't show any lesions. Sometimes the productivities are affected very mildly. Very few literatures are available on that one, but they don't get affected seriously. It don't die, but the chicks dies because of that sometimes.
Okay. So the next question is with related to ORT, sir. So that person want to ask that this ORT we need to consider is as a threatening, or maybe it's considered as a primary infection or a secondary bacterial infection.
Warty is mainly a secondary bacterial infection, especially in the broilers and the layers. But sometimes there are reports also in broiler breeders. Broiler breeders they found it as a primary cause, but in the broilers and in unlayers, they are reported with as a co-infector. That is why when I saw the diagram and when after Gopal Krishnamurthy's chart of the incidences, you find 34% of the birds who are co-infected with E. coli and these ones. Sometimes with the Newcastle, sometimes with the Bordetella.
Okay. So the next question is, so is there any preventive measures at broiler farm level for Pseudomonas disease?
At the broiler farm level, the real isolations and the treatments and all is very scanty as of now. Bacterial, as I mentioned, we have to first understand whether it's possible or not, means whether it's present or not. But I can answer in the perspective of the breeders. We have seen whenever the flock is peaking, when it is getting hit, we have recommended just before the peak administering the antibiotics. It has reduced the load significantly, and the flocks are not getting hit. If the unit or the particular locations is affected by this particular disease, administration of these antibiotics has significantly reduced. But in broilers, even identification itself is, as of now, is difficult.
Okay. So one direct question is there, like, can we use amoxicillin for the Pseudomonas and Warty both?
Amoxicillin, I found very much encouraging for the Warty. Definitely, in my experience, I have found even Dr. Hafiz also reported the very much same 250 ppm of amoxicillin or 20 milligrams of active ingredient per kg body weight has given very excellent results in case of Warty. Pseudomonas, amoxicillin also one of the choice, and other DEX also is working. Sometimes Cipro I found good results, but amoxicillin also is given these things. But in case of Warty, I found extremely good results with amoxicillin.
Okay. Okay. So one of the hatchery person actually asking this question, sir. So
yeah.
So he do lot of hatchery monitoring programs, and generally he conduct Salmonella, E. coli, and fungal infection. So so do we need to go for this Pseudomonas testing as well in the hatchery?
It is highly recommended. When it is if you are going to take up the hatchery hygiene audit, Pseudomonas and the staphylococcal is the two organisms which is always have to be considered while you are conducting hatchery hygiene audit. It is always recommendable to add these two.
Okay. So the same person is actually asking. He use lot of disinfectants, sir. Actually, like different type of disinfectant. He also do shuffle program in the disinfectant. So any specific disinfectant you want to mention that we do as a prevention program to avoid this type of bacterial infection?
If I answer this question, as I mentioned, sometimes even the simple disinfectant itself will be very effective. For example, as I mentioned, in the floors, walls as well. Even the hypo will do a very good job. But when it comes to the machines, you cannot do that. In humid conditions, glutaraldehyde and quartz does a good job. Here, rather than the type of disinfectant, rather than the big list of infectant, you should always look the disinfectant whether these particular organisms is listed or not. That is quite critical. Second thing is that disinfectants are that you get resistant. You got me, doctor? Suddenly there is some. Are you able to hear me?
Yeah.
Okay.
Some disruption.
So,
yeah, you can.
Yeah. So when you look at it, it is very quite important that the contact time prescribed is very, very important. That is quite critical. Rotate that, and frequency is again the important. And see the claim by the manufacturers whether it's effective or not. These are the three particular points we have to do that. And fourth one is that when they do have bangers or the bursting of the eggs inside the hatcher, it's very important that you have to take out that and do this cleaning. If you are not, for example, if Your machine is the automated machine. You cannot remove it every day and take it out. You have to take care the loaded eggs which is set inside are of the good quality, thoroughly fumigated. Otherwise, if you set inside, you will be having trouble in trying to correct the problem.
Okay, sir. So next question is, as a veterinarian, how should we prepare for emerging diseases like ORT, as it shows so much similarity with the fowl cholera?
Yeah. In this, it's not only about ORT or Pseudomonas. Generally, when we try to go and understand a particular problem, we always happy with, especially bacterial diseases. We give some conclusions. We think this is the problem. We are trying to use some medication. It will control. But many a times we miss to confirm it. The problem is ORT or whole control. When you do so, you will get lot of doubts. The bird might be responding to antibiotic. The bird might be able to respond to your treatment, but is it exactly the same problem? That is why I'm insisting, whenever is possible, as much as possible, once in a while you have to go through these kind of a cross verifications to understand, culture it, run through the PCR. If some places, very interestingly, they have found the initial stages they did not get positives, but when they subjected it to the ELISA, they found it interestingly very high titers. So it's an indirect evaluation. So you have to combine the strategies of diagnostics to get a clear idea.
Okay, sir. So the next question is again on ORT, sir. Does ORT infection in broiler breeder causes loss of heavy production and mortality?
Broiler breeders, yes. I would say the production losses would be something around 10 to 15%. And the mortality, rather than 0.254% an average, if it is the normal book standard, you will tend to get slightly higher percentage of mortality, maybe 0.5% mortality per week. Yes, in broiler breeders, you do get higher mortality, you do get a higher
Okay. So next question is how to differentiate between Vvnd, LP and ORT infection. So lesions what you have shown in your slides are similar. Young flocks coming into production are showing these symptoms and mortality is around 5 to 10%.
Yeah. Vvnd, ORT and another one, doctor?
LP.
Okay. That means you can Newcastle, very well in Newcastle, low pathogenic avian influenza.
Low pathogenic, and,
and what? Especially this is a quite challenging subject when it comes to the commercial layers. We have found this one very troublesome, especially in commercial layers I have shared. By looking at normally in cases of virulent Newcastle disease, the torticollis will be quite conspicuous. It will be there, and the cecal tonsil hemorrhages and everything will be there. In case of Newcastle, in cases of low pathogenic avian influenza, there will be very thick carpet-like appearance of your trachea, wherein if you even press the trachea and try to remove it, it will not go. The color will not go. But in case of ORT and this thing, you have found it. It slightly moves ups and down, and you will find it very fluid type of watery material. Blood will be there. So this is the one thing. But most oftentimes people get ILT as well as this one also get confused. So only diagnostics will give you better. Postmortem by looking at the trachea sometimes will be quite challenging.
Okay, sir. So this one question is from Dr. Sivakumar. So many a times in layer flocks we see mouth ulcer, but the production is normal and not reduced. What could be the cause? Is it a toxin problem or I think I don't know.
Yeah.
Okay.
Doctor, this T2 toxins causes this kind of a problem. Mouth ulcers, definitely it will be there in upper pharynx if you open and see that one. Sometimes you will find mild stain, but I have also these mouth ulcers has not created a big drop in the productions, but in the later on when the kind of an ulcerative things goes and occludes in the trachea, that particular time you get some mortality, but not significantly. Yes, that's right. We didn't find, I also observed the same phenomena. We didn't get a big difference in the productions. Moderately, it is affecting.
Okay. So those chicks getting low, body weight, and then chicks automatically getting high. I don't know is it related to our today's topic or not, but still I will read that question. So he wants to add some chicks getting low first big body weight, and for that chicks after 28 days getting IBH infection. How is it correlate? Please elaborate. I didn't get the question correctly actually. I don't know.
Okay, I think he's trying to ask the first week body weight is low and the incidences of IBD is getting higher, right?
IBH, sir. 28 days getting IBH infection.
IBH. Okay.
Yeah.
Sorry, I'm not quite sure I know the answer. I need to little bit look into that more data. By just these particular 2 points, it's difficult for me to make some judgment.
Okay, sir. Okay, so let me check some questions still pending or not. I think you covered this, sir. I think differential diagnosis between infectious coryza and ORT, sir.
Infectious coryza and ORT, yes.
ORT.
Yes, sometimes you do get confused with the infectious coryza and ORT. In both cases, infraorbital sinuses will be swollen. This is the one common thing. And second common thing is that the closure of the eyes is also common in both cases. That's the second thing. And third one is that if you look at the nostrils, you will find occlusions would be there to some extent in the IC. So these are all the common things between IC and Warty. But if you want to differentiate it, Tracheitis is quite pathognomonic in Warty, but in coryza you will not get that much severe tracheal tracheitis. That is the first thing. Second thing, in ORT, you will not find the foul smelling discharges in the nasal, these things, but if you look at the coryza, you will find foul smelling discharges in these things. And third thing is that the lower respiratory tract, like asaclitis and These ones, petechial hemorrhages is conspicuously present tetanomonically in Warty, but you will not find that only up to the tracheal, these things you will find some information in coryza. This is the difference between Warty and coryza.
Okay, sir. This question was from Dr. Kudikar, sir, actually. Okay. So I don't see any questions now, sir. So I think you have given lot of questions came, and you have given a very nice elaborative answers to all of them.